one, welcome to Move Well, Live Well, and welcome to Wednesday Q&A, where we answer your questions. I have here, it's Toli's Time on Earth, and Toli's Time on Earth writes, hey, I've had back pain for over 1.5 years and was diagnosed with spondylosis, stress fractured pars. What can I do? I went back to play and they started hurting again after 4 months of rest. So now what the heck is spondylosis? And what the heck is a stress fractured pars? Well, spondylosis refers to degenerative changes within the spine. It's kind of like a general term for wear and tear of your spine. Kind of like degenerative joint disease or degenerative disc disease in your spine, and they're starting to get bony changes and the disc heights are starting to get smaller and smaller. So that refers to spondylosis. Now, spondylolysis refers to the stress fractured pars that Toli's Time on Earth is referring to. So spondylolysis is there's an actual break in the pars interarticularis of the arch of the vertebra. So that stress fracture, that's called spondylolysis. Now, spondylolisthesis is when the vertebra itself starts to slip forward in reference to the vertebra below it, typically at L5, S1. L5 starts to slip forward because of that break in the pars interarticularis. So just want to make sure we get all those terms correct. So what can you do for this? Well, first, obviously, you want to make sure you're seeing a reputable chiro, a reputable physiotherapist, PT, an orthopedist, even a reputable, in conjunction with a reputable personal trainer, possibly, to make sure that the exercises and activities that you're doing, you want to make sure that what you're doing, you're having impeccable form. Make sure your form and technique and your mechanics for your daily activities are up to par, and definitely emphasizing core strengthening. Now, you know, a lot of people think their core is their abdominals, when really the core is your spine. Just like an apple core. The apple core, you know, you have your apple, and the core is actually from the top to the bottom, the center from the top to the bottom of the apple is the apple core. Kind of like us, you know, our core, top of the head, neck, our spine, all the way through, down through our tailbone. That's our core. So you want to make sure that your exercises that you're doing are very, very impeccable in the form and technique that you're performing them. So that way, as to minimize continued wear and tear on your spine. And it says here, you went back to play and they started hurting again after 4 months of rest. That's wherein kind of something, 4 months of rest, that's a long time to be resting. Now, I'm not saying don't rest. I'm saying that, you know, if you have an acute injury and you hurt your back and you created this pars defect, you created that stress fracture in there, what is that? It says over 1.5 years ago, possibly, that too much rest will weaken those areas of your spine, and too much rest is not good. And not only will too much rest weaken the muscles that stabilize your spine, but it will also increase the amount of scar tissue in and around the spine. Now, scar tissue, it's not as pliable as regular tissue. You know, the fibers are all kind of laid haphazardly like this, and that tissue becomes less pliable. It's like gristle. You know, you have steaks or something like that, you eat meat or whatever, and you get that gristly, that's kind of like scar tissue in there. And then you're just going to be less and less mobile over time. And it's going to be harder, more difficult to get back to where you were before. So too much rest, 4 months, that may have been too long. What you should do is after your acute injury, you know, you want to give it a little bit of rest, but as soon as possible, as you can tolerate your activities, you want to get up and moving as soon as possible. Just like, you know, folks that get knee surgery or something like that, they want them on their feet that day to get the circulation moving, get the, you know, minimize the amount of scar tissue, get the range of motion back, because that's how joints and your tissues of your body get to healing properly is proper circulation and movement. It's the lack of movement that causes degeneration of the joints in the first place. You know, folks, let's face it, we sit way too much. So by getting up and moving, the joints can move, the synovial fluid can exchange. Man, what's synovial fluid? It's super filtered blood plasma. So it comes from the blood. You know, last time I checked, you need blood to heal. So that when you're moving, the synovial fluid can come in and lubricate the joints and give them nutrition and give the cartilage nutrition, and everything heals more properly by movement. So the lack of moving, therein lies your problem. So as soon as you can tolerate, you want to make sure you get up and move within those, within reason, within those pain-free ranges, and slowly increase those ranges with your exercises. Again, with the guidance of a proper, your well-versed chiro, physio, orthopedist, personal trainer. So thank you to Toli's Time on Earth for your inquiry. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who may have issues like Toli's Time on Earth, in which they have a pars defect, spondylolysis, spondylolisthesis, or spondylosis, which is just degenerative changes in the spine, osteoarthritis. Share this with them. Sharing is caring. That way they can know what to do if something like this is what they're experiencing. So share this with them. Sharing is caring. Also, give us a thumbs up. Give us a like. It lets us know you care. Thanks for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.